A little while back, I made a video on health insurance and why I believe it's the biggest scam of all time. Still believe it to this day. Nothing's changed. Probably never will change. But I just wanted to make this video, hopefully it's quick, on my experience in the last couple months with my healthcare service. It just gets better and better. Um, I think in that video I mentioned that I have been dealing with very, very severe psoriasis for the last 2 years, and it did recently get to the point where it was covering literally my entire body except for my face. There was hardly any clear skin left on my body. It got that bad. I could have been on one of those fucking like TLC Dr. Pimple Popper fucking shows, and like seriously, it was that bad. Like that is how extreme my condition got. And I had to fight and fight and fight just to be fucking seen by the dermatologist and to get in the clinic and actually, get something started. And it was just one of the biggest hurdles I've ever had to go over, persevere through. It was just unbelievable. But anyway, quick little update. I am doing much better now. I did start a medication that has really cleared my skin just over the last month and a half or so. And I am very, very grateful. I am by no means out of the woods yet, but I am very, very happy with the progress that I have made so far. And I do hope that it continues. I'm praying that it continues. It has been nothing short of miraculous, the clearing that I have experienced, and I actually cannot believe that I'm seeing normal skin on my body again, because it's been 2 long years. It's partially been my fault too for letting it kind of progress this far, but yeah, I'm just very grateful that I'm actually finally starting to see clearance. I am by no means out of the woods yet, though. Of course, insurance is going to get in the way of shit, I'm pretty sure. With the new year incoming and all that, might be switching insurance, and I might have to go through some garbage again. But anyway, that's not the point of this video. The point of this video is I just received a letter in the mail today from my clinic, and they wrote to me going over my behavior over the last couple months and how I have been a problem patient for them. The most mind-boggling shit that I've ever seen is what they sent to me in the mail today. They have been so neglectful of my care and just listening to me and all my concerns, and because I was going through hell with my skin, literal hell with my skin. It was so fucking unbearable what I had to deal with day in and day out, and I'm still not through it completely. I am doing significantly better, but by no means am I entirely done with it. And psoriasis is a condition that is lifelong. It is chronic. It is with me forever. But it's being managed, and I'm grateful for it. But anyway, so my clinic, I'm not going to say names or anything, just, for the sake of privacy, but I look at the letter right now, and this was sent out on the 20th of October. So yeah, they're not even fucking hasty on getting out a letter like this to shit on me. It took over 2 weeks for this shit to even get to me, so not surprising with them. But yeah, they write, the purpose of this letter is to address specific concerns related to your recent behavior during your interactions with the dermatology team at our specific clinic, and outline expectations for your continued care with us. Some of these interactions are provided as examples. So they listed 5 examples of my just unacceptable behavior. I just was so problematic for them. I'll go over each one, and yeah, this will be fun to read through again. In your MyChart message, dated in August, you at multiple points asked the dermatology provider to address your panic attacks and anxiety, despite it being explained that these are best addressed by your behavioral health provider. Okay, so to go over that, in my MyChart messages to my dermatology team, my skin, again, I'm probably like 95% covered in just fucking pure red, painful red plaque all over my body. I was concerned that I had a life-threatening form of psoriasis, which does exist. And I was extremely concerned, and yes, this did cause anxiety and panic in me. I would absolutely lose my shit because I was so worried that I was near this life-threatening form of psoriasis. And it's funny because I was actually told, or I actually admitted myself to the emergency room in early September because my skin was just so fucked. It was so red. It was nonstop itching, burning, the worst it's ever been, the worst it ever felt. I was really, really concerned about my well-being and my health. And the doctor that I worked with there did get in contact with my dermatology team, and they actually did say, yeah, he should probably monitor himself, just in case it is this life-threatening for him. But there's nothing we can do for him right now. So just send him with a big fucking tub of steroid cream to just slather all over his entire body, and that's all we can really do for him. We can't give him any other medication for it. And that was my emergency room visit. But yeah, before all this, in August, I kept asking my dermatologist, I'm like, dude, like, you have multiple sets of pictures of my skin just getting progressively worse. Like, I need you to tell me that I am okay, that I will be safe, even given my amount of body coverage. He would never, ever go over with me in the messaging that I would be okay, or he actually views me as stable, or, I don't need to have immediate care or anything. He would never address it whatsoever, would never bring it up. He would literally just tell me, you need to get your anxiety under control. You need to get this, you need to see a behavioral health specialist about this. He would never once give me reassurance about my condition, even given the severity that I was in. He didn't give a fuck about it whatsoever. He did not care. And it's funny because in July I actually did physically see him, and in just a month's time the amount that it spread was unbelievable. So I went from my arms being partially covered to my arms being almost entirely covered, along with the rest of my body. My arms were really the only other thing that was clear, and then they weren't, and I was just spiraling out of control, both physically and mentally. My skin was so fucked. It was just unbelievably bad. I would itch unconsciously at night. Couldn't sleep at all. Would be lucky to get a few hours because it would just be constant itch and pain. And yeah, they've had photos documented about this for a long time, and I was just very concerned. Like, I was obviously very scared. I was scared shitless that something bad was going to happen to me, like, any day, because my skin was so bad. It was covering almost my whole body. And they said that I was asking the dermatology provider, my actual dermatologist, to basically handle my panic attacks and anxiety. They don't even say it was related to my psoriasis. Of course, they leave that out, because yeah, it was related to it. I wasn't asking him like, "Oh, I'm having a panic attack. How do I help this? Can you help me out, doc? I know you deal with skin, but yeah, can you just help my panic attack and just general anxiety about other shit other than my skin?" No, I wasn't asking him anything like that. It was purely based off my skin. Every question that I ever asked him was related to my condition and how severe it was. But no, that just got ignored, just, thrown in the shitter. It totally was not addressed, so that was great. But no, I was a problem with that. Here's the second one. In your MyChart messages, you also keep asking questions that have already been addressed at multiple points in person, by phone, and MyChart. The way in which this is being done amounts to asking your dermatology provider to provide treatment of your anxiety rather than your psoriasis. So yeah, that's kind of in relation to the first point. They are basically telling me that I am asking my provider to provide treatment of my anxiety instead of my psoriasis. Every fucking question that I've put in there was related to my psoriasis, because I was legitimately concerned that something horrible was going to happen to me in a very short amount of time, given the amount that my psoriasis has spread in this short time, like since my visit. It was incredible. But no, they're like, oh, you keep trying to ask him to provide treatment for your anxiety rather than your psoriasis. What are you doing? You are being a big problem to our dermatology department with this. Again, it's not true. I of course, for the sake of like privacy and all that, I'm not gonna fucking show like my chart messages and shit like that. I suppose I maybe could, but it's just not something that I'm gonna risk. But who knows? There's probably people that be like, oh, this motherfucker's making shit up, stupid shit like that. Whatever, I don't really care. But yeah, I find that absolutely comical that they would say that when everything that I've ever sent to the team has been related about my skin. Like that's why I'm sending you specifically messages. I'm not a dumbass. I'm not gonna sit and ask a dermatologist to cure mental health conditions. All I was asking for was, just basically reassurance on the condition that I'd be stable, given that it was so bad. But I don't know. That's not related to my skin, though. What do I know? Moving on to the third point, it says, you have expressed unrealistic expectations with regard to receiving immediate replies to your MyChart messages. This is also hilarious because whenever I would send a MyChart message to someone, typically, at least in the past, when I've gone through other providers, I'd typically get a response same day. Like even if it was later in the day, I'd get a response. And that's fine. Like if I send it in the morning, I understand people are busy. I'd get a response maybe in the late afternoon by the time, people are leaving. And that's fine. I get it. People are busy. I would send a message, say on a Monday, to my dermatology team, and I would sometimes just not get a response until Wednesday, Thursday, later in the week, way later in the week. And that'd be it for, I'd get maybe one, if I'm really lucky, 2 responses in the entire week with questions that I had about stuff. And it's not even just about my skin condition. It was in regards to also trying to get everything in order to start treatment for my psoriasis. So because I started on Skyrizi, that's the biologic that I'm on right now, I needed a bunch of shit because of bullshit insurance submitted over to different places in order to, get approval for this medication. So a part of this was me bugging the fuck out of them to simply fax some documents to AbbVie, who's the one who runs Skyrizi, or goes through Skyrizi, whatever they do with them. All I needed was that for them to provide some documents to them, literally just fax some shit. It took them over a week to simply fax 2 things over to them a week. A process that would take, 5 minutes maybe to do. Very, very simple process. I totally understand. They are busy. They have other people to see. I am not the only one that they're dealing with. Totally get it. But they know damn well that my condition is very severe and I need to, get on a treatment. I need to get on a fucking treatment and because of how bad I am. No sense of urgency whatsoever. I called the clinic as well and was like, hey, can I speak to a member of the, dermatology nursing staff? I just need some stuff faxed over. That's it. And they'll be like, oh, yeah, we'll have them give you a call later today. And I did that probably 3 times. Not a single time did I get a call back. Not once. Never got a call back from them. It was only after, I think, 1 or 2 more times, I actually was able to speak to someone right away, like as soon as I called, instead of waiting for a call back. Absolute bullshit, in my opinion. Just fucking ridiculous. But yeah, apparently that is unrealistic expectations in regards to receiving immediate replies. They apparently think that I expected immediate replies. I didn't expect immediate. I didn't expect it to be 5 minutes after I contacted them. I expected it to be, preferably same day, if not the next day. Not fucking 2-3 days after I submitted in the morning on a Monday. That seems a little bit outrageous to me. But I don't know, maybe I'm just off my fucking gourd thinking, that's reasonable. So yeah, I have way too high of expectations, I guess, with timing. Anyway, on to the 4th point. On this date, you completed release of information form allowing us to only disclose to AbbVie the proof we had appealed your denial of Skyrizi. You then expressed irritation with the dermatology team that they would not fax information that was not covered in the initial release of information. This kind of goes with what I just mentioned. There was shit that they actually didn't even tell me about that I would need to have submitted over to AbbVie first. They just hit me right in the nutsack with, oh yeah, we need this form filled out, by the way, before we can even do anything. Sorry, this was all stuff that they said would be no problem. They'd be like, oh yep, you just reach out to AbbVie and they'll work with you on the program and get you started on Skyrizi medication. Nope. I needed to go through all this bullshit with prior authorization denial and having all this documentation forwarded and all this shit forwarded to AbbVie. It was just a fucking mess, and I was of course the middleman for it all. Real fun time. But yeah, that I was apparently in the wrong because they didn't tell me exactly what I needed, and initially I had to find out the hard way. I was like, wait, I have this like denial and stuff, why isn't anything getting going? Oh yeah, by the way, we need you to fill out, this we need you to fill out this form and this form. You should have known that. And of course I didn't. They initially told me like, oh yeah, you'll just go through AbbVie and they'll get you set up with it. That's pretty much what I'm told. No, that was not the case. There was just surprise forms to fill out, and people just not having any sense of urgency on getting shit faxed over. And my doctor did initially, one of the things that I did initially need, sorry, I'm kind of all over the place with this. One of the things I did need was an appeal letter sent over to insurance. My doctor, my dermatologist, said that I could submit my own appeal, and that would be totally reasonable. And I was like, wait, are you sure? Like, that doesn't really seem to make sense. Why would I submit it? Wouldn't it make sense for you to submit it because, you're the doctor, you're the one who's actively seeing me? He said, no, your appeal will be just fine. You can submit it through the website, and that'll work out. And so I did that, and I want to say like a day or two later, I contacted insurance to ask them about it. And I was like, does my appeal count? Like, is this something that is actually able to be used towards this in order for me to get the ball rolling on, trying to get this medication? Sure as shit, they tell me, no, your doctor needs to do that. Of course. So then I believe I sent him an email stating this, and I don't remember if it was in regards to this exactly, but it was, there was a phone call that he made to me. He reached out to me to kind of go over everything that was needed in order to, get moving on this program. So we had a little chat. I want to say it was like a 10-minute chat or something about, getting everything ready and just, having clarification that everything is in order. It's like, okay, do we have absolutely everything that we need in order to get this submitted and finally, just be done, and they can get the ball rolling finally on getting the fucking medication. Had a chat with him about that, and I asked him a couple questions as well on the phone, just to be absolutely sure that we're good, because I didn't want to have to deal with it again. This motherfucker had the audacity, and I don't know, maybe I'm in the wrong here, or this belief too. He billed me as an office visit for that phone call, and he's the one who reached out to me in response to a message that I left him. He's the one who reached out to me. I didn't demand a phone call. He could have easily just sent it in a MyChart message, whatever. That'd have been fine. But he reached out to me. I was like, oh, that's cool that he actually called me. But no, he billed me for a actual office visit when it was just a, I think less than 10-minute phone call with him. And yeah, they have the right to do that. And I was actually told by insurance that they can actually bill me for any MyChart messages as well. And that I'm fortunate that I have not been billed for MyChart messages, because he has wrote me very lengthy responses to me. So yeah, guess I won't be fucking using MyChart anymore with this clinic, or at least very, very seldomly. Hopefully I won't have to though. But yeah, had that going. Moving on to the final point. This one was funny too. another date in September, you showed up to clinic without an appointment and demanded to be seen. This right here is fucking hilarious. So I did walk in to a clinic. They only have one clinic in my area for dermatology. So I went there and I was told, yeah, that I should be seen. The only reason that I even did this was because I called a triage nurse that's actually through this same clinic. I called a triage nurse and told her what was going on, and I'm like, no one's really helping me out here. Like, I keep getting, the runaround. I can't go to urgent care because they're not going to do anything for me. If I go to the emergency room, they're basically not going to do anything for me because I'm not in, like, an active, life-threatening situation. It's just my skin is so fucking bad, it feels like hell, and I'm just, suffering unbelievably. So I didn't know what to do because I was losing my mind and things are not getting sped up to try and get me my medication. So I was at a total loss. I was like, what am I supposed to do here? I'm miserable. What the fuck am I going to do? And the triage nurse that I spoke to, she's like, you need to go into the dermatology clinic and tell them that I sent you there to be seen. Like, that's my recommendation. So the triage nurse told me this. She obviously either did not relay that information to the clinic, which I thought she said she was going to, or they're just talking out of their ass in this letter, which is the more likely scenario, in my opinion. So yeah, I was apparently a fucking asshole going in there and saying that I demanded to be seen because, yeah, I was told by a fucking triage nurse to actually go into the clinic and say, hey, I'm miserable, and yeah, the nurse recommended that I be seen, so here I am. But no, I was a major fucking asshole and just demanded to be seen. Surprised I wasn't kicked out by security, even though I treated everyone with the utmost respect there when I arrived. But no, I demanded. I put my foot down and yeah, apparently like threatened them that I needed to be seen immediately. Found that just absolutely comical, man. It just goes on to say, the behavior mentioned above is in violation of our patient rights and responsibilities. In order to continue receiving care here, we expect the following. Work with your behavioral health care provider to address your concerns regarding panic attacks and anxiety. If you are unhappy with your current provider or behavioral health team, or our behavioral health team is happy to help you connect with someone new. Yeah, and we got a few more here. It says, do not show up and demand to be seen when you do not have an appointment. Our schedules are by appointment only, and we ask that you call the clinic if you need to speak with the nursing staff regarding your symptoms. Next point, provide clear and complete release of information requests if necessary. We are required to protect your health information by HIPAA. Contact us if you need assistance in identifying how to appropriately complete an authorization form. Fuck me, I can't read. Last point was wait for a response to your MyChart messages. After submitting a message through MyChart, please wait for a response before sending additional messages on the same topic. This ensures all inquiries are addressed fairly and efficiently. Replies may take up to 5 business days. Oh boy, yeah, that's real speedy, real fucking speedy there for someone who's basically in dire need of treatment. But to them, I'm just another poor soul that they don't really give a fuck about. And that's unfortunately the state of all healthcare, in my opinion. It just seems to be going downhill everywhere you go, which is just really, really heartbreaking. Let's see, it says these expectations help create a respectful, efficient, and safe environment for everyone in the clinic. Failure to adhere to these expectations may result in the discontinuation of services and dismissal from care. Sincerely, this shitty clinic. Yeah. So that was the letter that I received today, and I was dumbfounded by the way that they worded all of this shit. When in reality, that is not how any of this stuff happened. It's not how any of it went down. I have been extremely, extremely patient and respectful to these guys, given the circumstances. Like, I am probably by far one of the worst psoriasis patients they've ever seen. and they view me as just, an absolute nuisance. That's how they viewed me, just as, just a fucking problem. And yeah, but I had to keep advocating for myself, because that was all I could do. I had to keep bugging them day after fucking day to finally get shit rolling and finally get my medication, which I have. I am doing significantly better, thankfully. I am so grateful that things have been improving. I still have some problem areas on my body, mainly like my legs and stuff, but overall we're doing so much better. I'm just so extremely happy to see clear skin on my body again, because I actually did think that I never would again, and it was really, really extremely dark for me, and very scary for a period there, and I never want to relive that again. Just absolutely miserable. And I admit I'm a tad bit traumatized by what I've experienced over the last few months with just my psoriasis, because man, I don't even know how to really word it. It was just simply like something that I would never ever wish anyone to go through. And if you've ever watched Dr. Pimple Popper, and you've seen people with severe psoriasis and everything like that, you can find videos on YouTube. I will say that I was actually worse than those people. I am not trying to downplay what they went through. They've had really severe cases. I, in my eyes, believe I was actually worse than those people in terms of body coverage of my psoriasis, which is crazy, because I would go on there and watch these videos and compare my skin to theirs, and I would actually tell myself I'm actually worse than them, and I truly believe I was worse. I only had, I want to say, my face, the palms of my hands, and the soles of my feet clear of psoriasis. Like, actually clear of psoriasis. Everything else was covered. Everything else was covered in red. That's all it was red. Red, itchy, burning skin. A nightmare to live with. And I sympathize with people that are going through the same thing and can't get help for it. And I understand how difficult it can be to try and get help with this. The healthcare system is fucked. Everything is just for profit now. I don't believe anyone is in it to actually make a difference in people's lives and actually help them. And it's a very sad belief that I have, but unfortunately that's just how I view things now with the healthcare system, and especially health insurance. Health insurance can go fuck itself. It's the biggest scam in the world. And I'll forever believe that. I hope it fucking gets abolished at some point in my lifetime. That'd be great to see. But anyway, yeah, just wanted to make that video and give an update and go over that really funny letter that I just received today, because this clinic is the biggest fucking joke in the world. And who knows, maybe eventually I'll actually show some pictures that I've had taken of my skin in the past and how it looks now. Maybe eventually. I'm not a big fan of really showing myself in any capacity whatsoever. So yeah, we'll see. Otherwise, yeah, sorry for the lengthy video. I was trying to make this as quick as possible, but of course I get rambling, and we're nearing a half hour here. But yeah, I just want to make people aware of the bullshit that goes on in the healthcare system. It is fucking atrocious, and they send out letters like these basically saying that I'm a problem, when almost all of that is a blatant lie and pretty much untrue, and it's fucking insane. But what can I do about it? More than likely nothing, because they are pretty much invincible. Not sure what I'm able to even do to combat this letter. It's just fucking bullshit. But if you've listened all the way through, I truly appreciate it. Thank you very much. I do plan on making another video just kind of giving a life update, and it will be including my skin condition, just how things have been going for me over the last couple months with not only my psoriasis, but just kind of life in general. I'd just like to, I guess, talk about that a little bit, and I don't know, go through it. I'm not really expecting anyone to really see it, but I just want to vent and get this out there. But yeah, that's finally it for me. Thank you guys.